part of an ongoing series of lectures on spine and health-related topics. Tonight we're going to be doing pillow talk, hence all the pillows all around me. So what I want to go over briefly is what goes into a good pillow and how they're helpful and what are different types for different styles of sleepers. So the first thing that you should know as a chiropractor, I obviously work with people and they're sleeping all their time because they're spending about a third of, everybody spends about a third of your life on a pillow, so it's important. So the one thing that's really important to understand is that in a neck, your neck is shaped with a forward curve, okay, which means it curves like this. So it means when you sleep at night, you want your neck supported, not your head supported. So when most people sleep, they often sleep with too many pillows, thrusting their head forward, and then they wonder why when they walk around, their head is sticking out like this. So when we look at different pillows, we want to make sure that when you lie on your back, your neck is supported, not your head. And when you lie on your side, that your head is supported this way or horizontally. You want your head to look like this when you're sleeping, not like this or like this. And when you sleep, you want your neck supported, not your head lifted. And there are many kinds of pillows out there for different kinds of sleepers. The one kind of sleeping I don't recommend is stomach sleeping because nobody's neck is this good for 8 hours at a time. So what we have is probably some of the most popular pillows out there are the Tempur-Pedic memory foam pillows. I find the memory foam pillows to be very helpful for people that really like a feeling of support, but some people don't like the firmness. I think it works really well for side sleepers. Now you have to remember too that the pillows come in different heights. So you have to work with your healthcare provider or with somebody that's knowledgeable to help you make sure that your head isn't dropping down here or isn't lifted up here. So I think the Tempur-Pedic pillows work very well for side sleepers, although for back sleepers it can often lift your head. So I don't like it as well for back sleepers. Very odd looking pillow, but that I like very much, are the Therapeutica pillows. A patient of mine used to call it alien pillows because they look very strange. Okay? But what they're very nice for are for people that sleep both on their back because it supports their neck and lets the head go back. And it has a higher section, so when you lie on your side, your head can also be nice and horizontal, not too high or not too low. So I find this works very well for back or side sleepers or people that are trying to train themselves from flipping from their stomachs onto a position here because it cradles them nicely and helps them to stay in this position. For people that don't like a sense of a firm foam, we have pillows that basically have a variety of sorts, have a sense of a hole in the middle so that the head can drop into. Again, giving you the opportunity to have the neck cradled and supported, the neck curved, and the head still dropping back with a softer material than the Tempur-Pedic foam, for example. There also are out there and popular are water-filled pillows. So you can fill the pillows with different degrees of water, and what that does is allow you to have more or less support. So you can tailor it to yourself. I personally don't like the sloshing sound. It keeps me awake. So it's not my favorite pillow, to be honest. But some people like them. There are other forms of what are called bucky pillows that are often filled with different kinds of material, okay, like buckwheat hulls, for example, hence the name Bucky, that some people that are back sleepers only, that sleep quite still and don't move around in the night, like the feeling of being able to just bunch up and sleep like this. I don't find that it works for most people, but some people, especially that have been involved with yoga or have trained themselves to be fairly still for long periods of time, actually very much enjoy the Bucky pillow. Some of them are a little bit wider and thinner. So as you can see, I've just done a handful of different kinds of pillows. There are many other kinds as well. I have my favorites, but again, it always matters about what is the person's neck problem, what history do they have with their neck? Is it a post-surgical neck? Is it a stomach sleeping problem neck? Has it recently been strained and just needs support now, but over time they need a different style of pillow? Is the person still using their pillow that their grandmother gave them, filled with down, that they bunch up and it only lasts for a few minutes? It's an individualized pattern that I really have to look at with each person to see what they need. So hopefully that answers some of your questions. It gives you a brief introduction to the world of pillows, but hopefully enough to help you explore further. So thank you for joining us for Dr. Craig and Pillow Talk.